Yeah, absolutely. Love that. Probably all going to wonder what I did in my past life at the end of this. It's not all about me, and the message is in the mess. So you will start to see why I am actually standing before you today.
So, what we're going to do?
We're gonna say it all together. Toxicity! There we go. Perfect, right? Thank you guys, everybody that's here. I appreciate you guys coming out, and I'm really excited to have this conversation with you because this is a topic that women have not gotten enough attention, and it really is, it's upsetting to me, but that's why I'm here today. But we need to have this conversation, and I'm really happy that you're here. Oh, you have so much coming to you. So I want to raise of hands. Who's been through menopause in this room? Oh, we need your love and support. And oh my God, please, can you give us like some special, can you tell us a little something? Who is in current menopause? Anybody that knows they're in menopause? Yeah. Who has no idea but does not feel well, or they're like themselves, right? Or who's really young and feels like not themselves? Okay, we just want to get I just want to get a little rhyme and a reason. Okay, so we got everybody in the mix here. Great. Okay, so as she was saying, I am a Tucson native, born and raised. There's not many of us, but I am born and raised. I do love this community. I have traveled across the world, and I definitely have a lot of cultural experience. So I got my BSN from the University of Arizona, and I will tell you, I actually almost quit nursing school. And I know that's weird to say, where I am today, but my mama Sally, she always told me, you always have to finish what you start. So when I decided I was gonna quit, that kind of went through my head. So I went to my last final, and I finished, and I thought, okay, but why I didn't want to finish was really because I had this love of sports and fitness and nutrition, and I didn't know how I was going to amalgamate it with nursing. I kind of thought I was going to be locked in a hospital, and I would be like Rapunzel trying to let my hair out. And lo and behold, I had a bigger plan here. So here I am today. And I got my nurse practitioner in 2008. I did it in family practice, and I ended up working for a general surgery practice, doing surgical first assisting. So I worked along surgeons and cut, sew, tie, everything in surgery. I then proceeded on to get my acute care in gerontology, so I could treat everything from pediatrics to gerontology, both acute and family practice. So I wanted to make sure I had everything, right? That actually speaks to my type A personality that you will find in my story will have been a little bit of a detriment to me. But I do believe, I appreciate the wealth of knowledge that I've got. So anyways, I started EDGE in 2018, and we are here today. We're at Plaza Palomino. This is my team, and I couldn't do what I do without these women beside me, as well as holding me accountable. And I will tell you that I do not discriminate on who I hire, both genders. I just somehow flock like amazing women to my side. So anyways, yeah, I just haven't had the men to come up. So if you need a job, you just let me know. I promise I don't discriminate. Who likes surprise parties? Does anybody here like surprise parties? Nobody? Anybody? Yeah? Okay. How do you like a surprise party where you don't know when it's going to happen or where it's going to happen and the intensity that it might impact you? Anybody up for that? Okay. We all get a surprise party in this room, except you. Okay, so anybody who's in the integrative space as a practitioner has probably had a pain to purpose story. It's why we are where we are. There was a point in which allopathic regular medicine had not really been able to help us, and it's why we do what we do. And my story is no different, and I will tell you from my experience as a clinician, your perfect storm is never one thing. It will never be just blank. There is a multitude of things that add up to lead to that time to where the downfall in the symptoms start to happen. So not every story happens as early as my story, but my story happened right out the gate. So I'm not sure what I signed up for. You're probably all going to wonder what I did in my past life at the end of this. And I promise this story is a little bit lengthy, but it's not all about me. And the message is in the mess. So you will start to see why I am actually standing before you today. And when I was actually born into trauma. I was a cesarean delivery, and I did not get to live with my biological parents. They had abused my brother, and so I went to my first foster home, never being breastfed. And as we know at this point, we know that vaginal delivery is very important for the microbiome, or those beautiful bugs in your gut, right? So I never got that experience. I never got the experience. I got beautiful government formula fed wonderfulness. That's what makes me so beautiful. So in my first foster home, I suffered some abuse, and at 3 years old, I started making myself vomit. And you can imagine all this GI, the trauma, everything that had occurred. So the judge had asked my mama, Sally, to take me. She had my biological brother and 5 other children. So she said yes, absolutely. And I went there, and I was thriving. But I was a type A people pleaser with a side of competitive. And that served me for a long time. I'm standing before you. But there's a point, as you see in my story, it doesn't serve me. My mama, Sally, will tell you that I was either extremely healthy or dying. There was literally like no between. And I did really well till I was about 11. And I got a weird thing called Ludwig's angina, which is really fun to say, not really fun to have, where you get a strep infection that creates an abscess and it tries to suffocate you. So I was emergently brought to the hospital. Luckily, I came out of that and did well until I was 13. And I had an appendicitis, but it wasn't your normal appendicitis. So I severed, formed an abscess, I got gangrene, and was unconscious by the time I hit the hospital. So recovered from that. They actually didn't really think I was going to survive. I spent 7 days in the ICU, and then another 7 days on the floor, and then I got mono in that time, which was also really fun. I was like a double winner there. So moving on, it goes until while I was in nursing school. So I was working 3 jobs. I was going to school full time. I was on the dean's list, and that's probably a little too much, right? So I ended up becoming a strep carrier to where the point I had my tonsils out. So this is like another hit to my immune system. So moving on till the age of 25, I was in a Firestone recalled tire rollover, and I was brought over to UMC, life flighted. And 8 surgeries later, they put Humpty Dumpty back together again. This is about the time I met Miss JoAnna. She saw me all put back together, and I just kept doing my thing. I kept pushing, right? Just kept pushing. But while I was recovering, I decided, so I was a nurse at that point, and I decided, well, if I have medical leave, I might as well go to grad school, because that's the thing to do, right? Like don't waste any time. So I decided to go to grad school. And while I'm working night shift, I finished grad school and I become a nurse practitioner. So during this time, I end up starting to become a triathlete at that point. And because you can't choose one sport, you got to choose 3. Can't choose one, because you're not cool if you don't. While I'm in this, I'm working like 50 hours a week at this point, and I started having this abdominal pain. Well, apparently from my appendix, that caused a lot of adhesions with all the gangrene. So that caused my bowel and my gallbladder, so they removed that. So there's like another hit, right, to my immune system, another hit to my bowel. So see how it's starting to pile up? Never one thing. I recover from that, and I go back, I'm doing my thing, and I really suffered a psychological trauma at that time. And I ended up going to Thailand for 3 months. So it was really good that I actually took a time out, right? So went to Thailand, I was getting myself better. And while I was there, it's funny how the universe works. So I'd been kind of asked to do less. Everybody was like, do less. And then a tiny little mosquito, you know how big a mosquito is? That laid me out. I got what's called dengue fever. So, yeah. So dengue fever, not a lot of people get that. You don't want that. And I didn't just get dengue, I got dengue sepsis. So I had to call my mama. After about 6 days in the hospital, then I could finally get on to what wasn't really Zoom, but get onto my computer so I could call her. And she felt very helpless, as you can imagine, being here in Tucson. And she asked me if she could do anything, and all I wanted was an EG. All she wanted to do was bring me that EG. And luckily I came out of that. And dengue it breaks your platelets, which makes your ability to clot your blood so you can bleed out, but it also causes a big gastritis. And so another hit to my gut happens. So I come back and I started to slow my pace a little bit, but then you know how like the world takes over and then you can't kind of keep that. So at this point with my surgical practice, I was only had 4 days off a month, and I was still trying to be a competitive cyclist because I gave up I wasn't a full triathlete at that point. I was just a competitive cyclist, right? Like, cause that's the thing you do. So I know, right? I just slacking. So I'm pulling back. And in this time, I decided to do a second master's. And because in my surgical practice, I needed to be able to treat acute care patients. And so I go back, I'm doing this program, and I'm literally doing my thesis. It's due that night. So luckily my hubby, he's a surgeon, and I started having GI issues. I went to all the surgeons were like, let me fix you, here, they'll send you this person, right? So they're sending me all these different people, and they're giving me meds that are like $400 a month, and I'm trying these, nothing's working. And I'm exercising, I'm eating well, nothing is moving through me. And I started like colon hydrotherapy. I mean, nothing is making me go to the bathroom. So I'm like in the OR and my belly is like a basketball. And he's like, you need to go get an x-ray. And I'm like, yeah, but I have my thesis is due tonight. I gotta get my thesis. And he's like, just go get this x-ray, please. So I go over, right? And I go back home and I'm on my computer, and he comes in and he looks at me and he's like, I think you're gonna perforate.
What's that mean?
Meaning like my bowel is gonna explode because it's so distended. And I'm like, I just didn't finish my paper. And he's like, do you mind if I make some phone calls? And I'm like, no problem. So anyways, we get through that small part, and then we end up actually needing to resect. So what they believe happened was the dengue fever caused the elongation. So I had 3 extra feet underneath my spleen. So they took that part out of my colon, and then I was living really well. So I was on top of the world at this point, guys. I was cycling, I was doing all my things. I started Edge, I won El Tour, I went to Alpe d'Huez. I don't know if anybody watches Tour de France. Anybody cycling? Tour de France is a big, huge climb. It's called Alpe d'Huez. I got engaged on top. Yeah. And I thought like everything was behind me. So while I started Edge, I was working with a mastermind group, and I was headed to California. And I woke up at 4 a.m. I'm trying to pack my bag, and I had this like intense abdominal pain. This is about like 2 years later. I, in my head, think I'm gonna send my team. I'm like, okay, you guys get my car, you guys go out to California, I'll fly in, no big deal, I've got this, right? In this process, I started not being able to keep up with my team. I did notice that there was a change. And I started thinking about it. And I'm like, man, I should probably test my hormones. And I was doing this, I did a mold test and a Lyme. Like I was like trying to look for anything that was trying to slow me down. And I got my hormones back first. And I literally had the hormones, and I apologize if anybody's 80, like nothing. I had 0 hormones. So I luckily had an appointment with my GYN. So I went in and I told her, and I said, so I don't have any hormones. And she looked at me and she literally, I kid you not, patted me on the back. I'm 35. She goes, early perimenopause. And that was it. No questions, no nothing, like, has anything changed in your life, right? And I was like shuttled out the door. And I got in the car and I was so angry. But I was angry not for myself, because I was a nurse prac. I have a lot of resources, right? Like I can work myself up, screw that lady. But I was angry for every person in this room. I was pissed that this is what healthcare was coming to. And I knew that that is what everyone else was going to be told. And that's literally why I'm here. I was so mad. And if she had seen what had happened next, because this was her world. I was mad that I couldn't push my pedal, right? Like I couldn't move my bike. Like why? Like that was what made me mad. But I didn't know when I went in for that GI study what my next thing was going to entail. My surprise was coming. And you can see here, this is the study that I had done. So this is the barium going up. You can see the kind of white colored stuff, right? That was where the original, where the colon was resected. Do you see how it's not going any further? Yeah. Yep, nothing was happening. So I was told to pack a bag. So I was not going to California. I was going to Tucson Medical Center. And I didn't know I was going to be there for the next 22 days. I didn't know that I was going to have 2 bowel resections. I was going to end up with no colon, period. I was going to end up with a bag and a PICC line in my arm to give me nutrition. I also ended up with a hospital-acquired infection called VRE, which is very, very terrible, and you have to take insane antibiotics. This is my beautiful dog, Layla, who came to see me. Every weekend, she would get to come. And I had that NG tube, that beautiful tube in my nose for 19 days, which I did not eat for 19 days. But had someone questioned what might have been going on, and this is why it matters, it's questioning and the right answers and the right questions. People need to be asking the right questions. So that's really why I'm here, because I want to be able to give you the right questions to be able to be answering and giving to your providers, whether it be me, whether it be someone else, but they need to be asking these questions. And I'm really sad that people aren't asking these questions, but it all matters to your hormones, but it matters to every other system in your body. What is perimenopause? So there's a lot of talk about menopause, right? And you're gonna hear tonight that you're actually in perimenopause a whole lot longer than you are in menopause, right? So there's this like triad. So I want to explain this. So when you look at cedar cyanide, you can see that they define it as the period before menopause. Is that clear? Anybody in this room? That really explains it, huh? So Mayo Clinic says if you have persistent changes more than 7 days of length of your menstrual cycle, you may be in early perimenopause. Huh. So I had a change, but I will tell you, I was 35, and after everything got fixed, my hormones were normal. They all went back to normal. So I wasn't really in perimenopause, right? It was what was going on in the system that caused the problem. So Franciscan Health will say the first sign of perimenopause is a typical or a disruption of the menstrual cycle. So how many times have you had disruptions in your cycle? Were you in perimenopause? Yeah. How many did you have? You have so many. So perimenopause marks the time when your ovaries gradually produce less estrogen and eventually stop releasing. So that's a little bit more with it, right? John Hopkins will say that perimenopause is a time around menopause when your body begins to change and you become less fertile and you have hormone fluctuations. So I want to redefine this for you. Perimenopause is a profound hormonal and reproductive change in women that can vary in the time and onset and duration. Surprise party, right? It begins with the first onset of menstrual irregularities outside acute physiological disease or trauma, right? So that's very important. There is a loss of ovarian reserve and ends with amenorrhea, which is when we no longer have a cycle. So these are, there are 2 stages of perimenopause, and these are called the menopause transition. There's early, where the cycle is mostly regular and has few interruptions. There is a little bit of less ovarian reserve, but there's no change in how your ovaries are functioning. And then there's late transition where you have prolonged for at least 60 days without a cycle until when you have 0 cycle for over a year. And then this is characterized by a multitude of symptoms. You cannot classify this as one, which vary per person in duration, severity, things like insomnia, anxiety, depression, breast tenderness, vaginal dryness, weight gain, decreased libido, decreased physical stamina, muscle mass, hair loss, dry skin, or wonderful hair growth, places that you don't want it. Yeah. Are you excited to be in this room?
There's just a lot to learn. Yeah.
I know, but you know what? I seriously commend you for being here because you have to be with us during this process.
That's why I'm here.
And if you have 0 knowledge of this, you're like weird and what's wrong with you? You know what I mean? It's not understood that there is a physiologic crazy thing going on inside of you that no one else is like, and they just expect you to act like you did when you were younger, and then you're no longer showing up as that human, and then they're like, but why? But why? And we can't, it's hard to control that, right? Like it's hard to show up if you don't have that hormone there, right? Hormones can make you crazy. But I love this. So an ovary cell is called an oocyte. That's fun to say, right? Oocyte. That turns into what's called a thecal cell, and it turns into a granulosa cell. And so over the cycle, it changes throughout the cycle, right? So the thecal cell is something that's an androgen, meaning like a testosterone precursor. And when we're starting into also the thecal cell, and cholesterol is what makes progesterone. This is only important for us in like a further slide where I'm just going to talk to you about like those where we might be losing those things. So that's the only reason why I bring this slide up. So I won't take you too deep into that. So let's talk about the stages here of perimenopause to menopause. So when we're in kind of like a stage 1 here, where on the left side of the screen, this is where we can have regular cycles to slightly irregular. So we might have some slight variations in what the cycle looked like, a little less days, maybe it's a little lighter, maybe there's a little more dark blood kind of thing like that. Normally at this point, if we were to check labs, we would look at what's called LH-FSH, so how your ovaries are functioning. And at this point, they look pretty normal. If we were to check an ovarian reserve, we would probably see a little less ovarian reserve, which is called anti-Müllerian hormone, which we don't check very often unless we're, and I will tell you, your primary will never look at this and they'll be scared of you when you want to ask for anything about your hormones. Does anybody have felt that, like when you want your primary to ask you about hormones or to do something about your hormones, or even your OBGYN? I don't know. So I will tell you this, OBGYNs, is anybody an OBGYN? Okay, all right. Okay, don't tell them I told you this. No, they really care about your organs, but they're really scared of your hormones. And it's really sad at this point where there was a lot of misinformation, and we're going to talk about that later in the slides. But there was a lot of information that came out about hormones, and people were kind of really scared about it. So primaries will not touch your hormones with a 10-foot pole, and most OBGYNs will not either. So it's hard because we want those people to bring up those conversations, and you're aging, and your primary will never check your hormones unless you ask, and they usually won't do that appropriately. So, and tonight I do have, and I'm gonna have you guys give me your email addresses because I do wanna send you, I created a guide, A, the right questions, B, I want you to have the right labs. Like if you're saying, I want you to check these labs, I want you to know what labs to ask for. And I also want you to know what types of treatments should be offered. Like what things should be people be presenting to you. Moving on to the second 2B. So at this point we can start to have varying what's called FSH. So now we're starting to see a little bit change in the ovaries. We are seeing less ovarian reserve. We're moving into pretty much no ovarian reserve, meaning you cannot produce. So you don't have enough fertility to have another baby. And then to point where your menses have completely ended. And at this point, you have 0 ovarian reserve. Perimenopause can last for 2 to 15 years. Menopause lasts for 12 months. The talk about menopause, so I see that there's a lot of books on menopause and right, but the talk on perimenopause, you are in a perimenopause state for a long time. And it can be different for every person. And we're going to talk a little bit more of why that changes for every person and why everybody's surprise party is a little bit different. Okay, so we have different levels of organization in the body. So everything, we come from the cell. So the cell is, there's different cells that are specialized to have different unique structures and functions. They move to tissues, which are a group of similar specialized cells, and then they go into organs, and then they begin to have different jobs in the body. So what are hormones? So hormones are actually chemical messengers, and they're secreted into the bloodstream by the endocrine system. And there's different endocrine glands in the body. They're actually all over the body, which I'll show you. So we have different types of hormones. There's one called, there's steroids. So those are things like progesterone, estrogen, testosterone, cortisol. Next, you're gonna have amino acids. So things like epinephrine, norepinephrine, that's your, what lead into cortisol production. And then you have peptide hormones. So things like insulin, growth factor, ADH, and GLP-1, which a lot of people have heard about GLP-1s with Ozempic and all those fun things, but those are made in the gut. Hormones have a target cell. So if you think about a cell, they have receptor sites. So you have a key and a lock, and you need them to join together. And we have androgen receptors in our body that are actually present in almost most cell systems. So everything from reproductive to musculoskeletal to cardiovascular, immune system, they're everywhere in the body. And every hormone has to fit like a key in a lock. And cellular inflammation is very important to think about. We get cellular inflammation from toxins from our environment, from the foods we eat, and so forth. So if we have inflammation around the cell and we try to put the key in the lock, it might not fit, right? So I have a great story. I was young, I was out at a bar, and I went to my car. It was probably really early in the morning, and I tried to put the key in the lock, and the key broke off in the lock. And so the person came out and was helping us move the car, and he said, "When's the last time you lubricated your locks?" Who lubricates their locks? I don't know. So it's a joke between my best friend and I to this day. But I think about it. I think about it in this scenario of like, if I'm trying to get my hormone and the key in the lock, right, I better make sure that is lubricated, right? I want it to go in that hole. So it's very important. Apparently that guy was right. I didn't know he was going to be part of this story. So I'd love to go back to this day. So this is a picture of where all of your different hormones are produced in the body. And you can see it starts in the brain and it moves all the way down to your ovaries. And it's very important because when we start to look at the questions of what is going on, if we interrupt one system, we start to interrupt another. So it's never just one thing. We have to chase it all the way up to the top. If someone has adrenal fatigue, we probably should look if the brain is even submitting what's going to the adrenal. We don't want to just look at the adrenal gland, right? Like what's going to the ovary, it starts at the brain. So we want to look at all the systems as a whole. Why every woman gets a different surprise party. So we are still, to this point of everything we know in medicine currently with women's hormones and in this process, we don't actually quite understand why everybody gets a new, like their own surprise party. So is it the ovary, or is it their brain, or is it the adrenal system? So the HPO axis is what's called hypothalamus pituitary ovarian. And so this picture is talking about right here, and I think I have a little cursor. So this is part of your brain here, and this is going to go down into the ovary. So GnRH is a hormone that starts to tell your ovaries, it secretes something called LH-FSH. So it tells your ovaries to secrete hormones. But it has to have some specific amino acids. So it has to have GABA and glutamate and something called kisspeptin. So if it doesn't have those, it can't quite send the signal. So they haven't quite figured out, is those amino acids lowering, or is it the signaling from the ovaries that's going less? Or is it both? Are they happening in different conjunction? We have not quite figured that out. We are our own unicorns here. But it's why when we're trying to support hormones, we're worried about things like amino acids and how even, and we're going to see this in a future slide, about how the gut decreases, the gut and the brain are connected through something called the vagus nerve. And if you have dysbiosis in the gut, which of course I had probably dysbiosis, right? Wasn't sending the amino acids to the brain, which then wasn't talking to the ovaries, right? So everything is connected. So in this process, so we're going down LH-FSH, you see estrogen, progesterone, and what's called inhibin. So then we have the HPA axis, so hypothalamus, pituitary, adrenal. So physiologic stress can activate the HPA axis, leading to the release of cortisol. Your adrenals, which release cortisol, will always do the best to save your life at all costs. And if you're under a state of chronic stress for a long period of time, there's a point in which they don't work anymore. There's a point where they're like, I'm really tired. I don't want to keep up with you. That would have never happened in my life, right? Nothing. No. So cortisol turns, in turn can suppress the HPO axis, and it will decrease the release of GnRH, FSH, LH. So now we can start to seeing disruption in how the ovaries are functioning, and then you'll see irregularities in the menstrual cycle, decreased ovarian reserve, and then premature ovarian insufficiency. These are 6 types of stressors that drive your body's system for widespread dysfunction. And this is everything from biochemicals, so these are the chemicals in your environment, blood sugar issues, food sensitivities, medication, psychological. This can be anything from, different traumas, whether it be work or home or financial. Oxidative stress, so these is how your body deals with, so if toxins come into the body and your body cannot detox them fast enough, you get what's called oxidative stress. And so sometimes people are genetically predisposed to this. And some of us have a harder time with those oxidative stress than others. And if we get too much oxidative stress, that will decrease the hormones. And then things like environmental toxins, glyphosates, plastics, metals, molds, those are all problems on the hormones. And then circadian rhythm, sleeping, right? So if we're having to be a shift worker and on call and having to go in the middle of the night, right? Like that, that's gonna mess with that. And as well as physiological, so overtraining, sedentary lifestyle, strain or injury, chronic pain issues, not being able to sleep through those chronic pain issues, surgery, childbirth, any of those things can disrupt hormone function. Okay, so these are age-related changes in the ovary itself. So we have everything, so in this I want to tell you guys, your mitochondria, so big word, it creates your ATP. So has everybody heard of ATP before? Yeah, no? Okay, so that makes your energy. That's your go juice. Everybody wants more ATP, right? So women, we are born with about anywhere from 500 to like 800,000 eggs in our body when we're born. And those eggs have like 500,000 mitochondria in every one of those eggs. So we are really good at getting rid of oxidative stress. But every time we lose one of those eggs, we have less ability, right? So the problem is when we have our first cycle, we have half the mitochondria than we were born with, which seems kind of crappy, right? Like we thought maybe hold on to those and then maybe the first time, that's the very first one. No, we actually lose those. So as we get less and less eggs, we have less ability to deal with oxidative stress, and then it's easier for other eggs to die before they're even ready to be released. So what we also see is women that are perimenopausal to menopausal actually have an increased rate of autoimmune conditions because you can't get rid of oxidative stress. So now you have more inflammatory patterns. And that gets just worse when we go into menopause. And we start to see how when we have the ability to deal with that oxidative stress, we have less DNA mutations, but we have worsening DNA mutations, and we age faster at that point. So effects on low estrogen. So we start to see hot flashes, anxiety, vaginal dryness, mood swings. We actually start to see increasing atherosclerosis, so we can actually see an increase of blood pressure at this point. Headaches, migraines, vaginal infections, constipation. Estrogen actually creates what's called serotonin, and serotonin actually helps with the peristalsis of your gut. You decrease the estrogen, you decrease the serotonin, you have more constipation. You have more joint pain. Again, we can't deal with oxidative stress as well. We have bloating, depression, memory lapses, walking into a room not knowing why you went in there, and frequent waking throughout the night. So we start to have this sleep problem. So estrogen has over 400 functions in the body. Estrogen and progesterone actually make your bone, and testosterone is the strength. So we see massive increase in osteoporosis in women. We also start to see an increase of LDL cholesterol. So all of a sudden cholesterol starts to be a problem. In this, I will tell you, your cortisol tries to help you. It goes, oh my gosh, her estrogen's down, so I'm gonna go up. So I'm gonna try to give her some estrogen. But the problem is that cortisol spills sugar. So we become more insulin resistant, and then we get really good weight on us, right? That's really hard to get off. Yeah, so it then starts to make it so where we don't feel the drive and motivation. So when we are of childbearing age, our estrogen is really high, and estrogen is a hormone that is like, go, 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 get everything done, multitask, care about everybody's feelings. That's what it's responsible for. But as we start to decrease it, we might not care about people's feelings so much anymore. We also might not be able to multitask so much anymore. And then our partners are wondering why we can't keep up with what we used to do. And they wonder, like, what are you, and then you're thinking, man, it's me. Why can't I do what I used to do, right? Like, you start to feel crazy. And the really sad thing in this is that women in perimenopause ages 40 to 55 have the highest use of benzodiazepines, alcohol, and it's the highest divorce rate at that time. So really important for you to be here. Benzodiazepines, things like Valium and then alcohol and divorce. So those are the highest times, the highest times in which we have those rates was between 40 and 55. And I can't imagine why that is, because we don't have joy and stamina and motivation. And we haven't even got into progesterone yet. So these are little side things you don't think of so much, but estrogen actually is a protection for colorectal cancer. So we see higher colorectal cancers as estrogen drops. We see a decrease in eye health and also an increase in tooth infections and gingival disease, and then memory, cognition, depression, and then also increasing like UTIs will happen during this time. Also Alzheimer's. So estrogen and progesterone are very protective for your brain. When we were treating, if people are have Alzheimer's and they're in their 80s, we will give hormones because it slows disease progression, and it's why it's so important to do these things early, especially if you have family history risk. Cardiovascular disease here, I just want to make a note on this, is that it's women are 5 times more likely to die from heart disease than breast cancer. It is the #1 killer among women, and discontinuing hormone therapy will increase the risk of cardiac disease and stroke. And that's because we have that increased risk, or that increase of LDL as well as that insulin and that glucose level. Women that started on hormones are actually 50% less likely to get cardiovascular disease, which is something that we're not taught at all, right? We're like, put the fear of God that you're going to get breast cancer if you do hormones, which we're going to touch on this about how there was very bad research done and how it was disseminated and how it's still being taught in schools. But the beautiful thing is I do see this universal shift, and finally women in the last year and a half, 2 years, have gotten a bit of an awakening with what's going on, and there are people that are going to change how medical schools are actually being taught, because it's currently taught incorrectly. And medical schools are almost the last thing to catch up, which is really sad, and I could get into statistics about that. That'll be in my book. I am grateful that there is a wave that's moving forward and that you guys get to have this information now. Effects of low progesterone. So progesterone is one of the first things to go when we're in perimenopause, and this is kind of a scary thing because progesterone is the one that will make you feel crazy. And this is when you hear about women with like PMDD. This is the problem is progesterone, and progesterone is a warm, lovey, feel-good hormone. It gives you joint laxity, it makes you calm. But as progesterone starts to drop, you feel anxious. You can have real random panic attacks. I had a woman that literally could not drive on the freeway, never had a problem ever. Then all of a sudden was having panic attacks, and she'd have to pull over and until we got her hormones sorted. I mean, this was her reality. So difficulty sleeping. Women have a hard time falling asleep, racing thoughts, and then waking throughout the night. So a lot of insomnia problems. You can get hot flashes from both low progesterone and low estrogen. Many people think it's just estrogen, but it's actually the balance of both. You can have a lot of fatigue from low progesterone. You can have weight gain, breast tenderness, bloating, and digestive issues, and hair loss. So androgen deficiencies. These are clinical signs that we see both in men and women. And we see a loss of energy, we see fatigue, we see a loss of muscle mass. As we age, there's something called sarcopenia, which is the loss of muscle mass over time. We see weight gain, exercise intolerance. You can't exercise as intensely as you used to, right? And we have to almost change our type of exercise, right, as we get a little bit older. Increasing the recovery time. So if we hit it really hard, it takes us like a little longer to come back. There's anxiety, depression. This actually can cause a lot of insomnia problems, waking throughout the night. Decreasing libido, and I didn't mention this on the estrogen slide, and a lot of people don't think of estrogen as libido. Most people think of androgens, but actually estrogen is a big one for libido. And then this can cause erectile dysfunction as well as anorgasmia. So women can get a loss of sensation, so the inability to orgasm, or it takes a lot longer, or it's not as heightened, and that can be from androgen receptors as well. Testosterone production, this improves the mood, overall sense in the brain, breast tissue and how the breast tissue proliferates. So it actually is protection for the breast tissue. It's protection for the LDL and HDL of the heart. Its protection is the strength of the bone, and this helps with your metabolism as well as urogenital function. So women as they age can actually get a higher risk of UTIs, and this can be from androgen as well as estrogen receptors. Yeah. We had an aha moment over here. I love this. So this will make you more and more pissed to the man in the room. Gold like daggers to him right now. Okay. So do you see? So here's the man. So men can have testosterone, and men have estrogen and progesterone just like women. They're just not as high. But men's testosterone can, depending on how well we preserve the body and we eat well, exercise, so forth. I have a man literally in his 80s with a testosterone of 800. They are fertile for a very long time. They don't just lose a reserve. We have a ticking time clock. We have a number of eggs, and once they're gone, we drop off. Do you see that testosterone line? Wait, hold on. I need everybody to see this. Do you see this testosterone line right here? Right, like that's a steep slope. So we don't get a choice. We don't, like, if you eat well and exercise and stuff as a man, most of the time you can preserve a lot of function. But as a woman, we don't really get a choice, really. It just like drops off to the end. So testosterone is not just for men. And women lose about 50% of their testosterone by the age of 30, which is also really scary because you also lose growth hormone, which is like the elasticity of your skin and your ability to recover. And there's really no established rates for men or women. And really, hormones are a feel thing. So even if I'm replacing somebody's hormones, so there's kind of a roundabout place you should be. But I will tell you that one person, let's say I give you some testosterone. I have some women, they want to be super high. They love every second of it. And then other people, very sensitive. They could feel agitated and a little bit aggressive if they get a little bit too much. So it's baby doses, like it's a little bit, right? So there's no target range. It's really about how you feel. And if I'm giving you hormones and you're perimenopausal, menopausal, I'm not here to make you fertile. I'm just here to make you feel good, right? Like I'm here to protect your bones and your brain. Like we're not trying to go astronomical doses. I have this cool slide and I just want you to know this about men. So this is actually a really cool thing to kind of see as testosterone decreases. You see like upper limits, there's this like protection for your lipids and your atherosclerosis, like any type of heart disease, so forth. But then as you start to go down, even as the men starts to get around 450, you see type 2 diabetes start to increase. You see coronary artery starts to decrease. And with men, we'll always, if someone has low testosterone, it is sleep apnea till proven otherwise. So if they're snoring in your bedroom, they probably have low testosterone, but it's probably sleep apnea that's causing a hormone. Because it's the stress, right? If I can't breathe, I'm not gonna lay down to make babies, I'm gonna save your life, right? So we gotta fix the airway before we can fix the testosterone. But it's cool to kind of see this where we can see all these cardiovascular risk factors as it starts to decrease. It's the same for women, but of course they haven't done this study.
Seriously.
I'm serious, they haven't done the study. No, I'm not, okay. So I'm gonna tell everybody in this room. Most of the research done to this point with every single medication, I do not care if it is lisinopril or omeprazole, all of these things have not been done in studies with women aging across the spectrum. So they are going to treat everyone in this room. I don't care if you're a 400-pound person or 125 pounds, they are going to give you the same exact dose of lisinopril. They don't care if you're a man or a woman. We don't know the difference, how your kidneys take it, how you're, right, and how you bring that in, and that is really terrible. And most research has been done on men in every type of medication across the board, which is really sad. And this, and until we have these conversations, we don't know that, right? We just take the doctor gives us the med, we take the med, and we should perform just like somebody else. But you're being given the cholesterol medication because your hormones are low, because that's causing your LDL to go up. But if we fixed your hormones, would your LDL go down and you never had to take the cholesterol med, right? Because with the man too, what caused the testosterone to go down to cause the cholesterol to go up? Was it sleep apnea? I should fix the sleep apnea before I fix anything. And that's why the questions are so important, right? We need to be questioning these things. Do you snore at night? Are you excessively tired during the day? If you sit down in a chair, do you want to just fall asleep? Those are all classic signs for sleep apnea. Those are all things that are going to mess your androgens up, right? So this is why the right questions aren't being answered in that 5-minute window that you get, right? So they're all very, very important. And you can kind of, if you kind of look through estrogen, progesterone, testosterone, you can kind of ask like, where am I on there? Are you 1 to 10? How bad are you? So what's the solution? I say this with a caveat. So when hormones are balanced, you can optimize about 80% of symptoms in the body. But what's the why of what messed up the hormones to begin with? So key lock, right? So if I have cell inflammation, if I throw a bunch of hormones at it, but the keys can't get into the locks, it's never going to fix the problem. You're not going to feel like the guy on TV. So we really have to ask the right questions. And I love this picture, and I kind of talked to you about toxic bucket, right? So we all are born with a bucket, and our parents give us some stuff so they can give us some heavy metals and so forth, whatever, right? You can get mono, you can get COVID, you can get pesticides, whatever, right? They fill the bucket. But what stops the bucket from draining, because your body does a really good job, is trauma. And I don't care if it's a car accident, a dog dying, a divorce, a move, whatever. Stress is what blocks the bucket. Then you start to overflow and you say, Maria, I was good until this day and then blank happened, right? It wasn't that day, I promise you that. How many things added to that bucket? What do I need to take out of the bucket? How do I get the bucket open? Like a classic thing I'll ask my patients is, one thing is I'll say, do you sweat? If you cannot sweat, that is a massive drainage from the body, right? It helps me detox your body. Liver, kidney, lymph, colon. If you're not pooping, if you're not sweating, if I don't have your kidneys and your liver moving, nothing is moving, right? We're going to get that bucket is going to overflow. So we got to open those things up to get things to move. So good question. I have many patients that literally cannot, they very much don't, they don't perspire very much. They literally say, I don't sweat very much. And I go, even if you're working out, nope, I kind of glisten. And it doesn't, but what you will also see with these people is that you will ask them, how well do they do in the heat? You say, do you get faint in the heat? Yes. If I put you in a sauna, you're going to feel sick within 10 minutes. That tells me that that lymph is broken, right? It's not able to move out. If you're like, I can sit in it for 60 minutes, no big deal, is that right? Okay, lymph is open in that scenario, but if you're getting sick very quickly within 10 minutes, or you don't take the heat and you feel very faint, that tells me it's not lymph, because your lymph is going to cool you down, right? You get hot, you're going to sweat, you're supposed to cool down, right? But if that system isn't working, that tells me we have a drainage problem. So all of these are really important to what is going to make this beautiful tree here. So how we call this a three-legged stool. We talked about the microbiome a little bit easier. What are the microbes in your gut? We also have stressors. We talked about the 6 types of stressors, and then genetic expression. Genes are a very small portion of what's going on. Inflammation is what turns a gene on or off. A gene, just because you have a genetic predisposition, does not mean you're going to show that gene. Now when you piss it off enough, you will express that gene, right? So that's how a disease really arises in our body. And we got to go, really the foundation of anything is optimal cellular foundation. So our cell is a beautiful thing. I don't even know how it was contrived. I mean, it is just a gift. And when we look at the cell, if we have cellular inflammation and we do not allow nutrients, hormones to come in and out of the cell as they're supposed to, so sometimes nutrients can get in the cell, but because of the inflammation out of the cell, they can't come back out. So it's kind of like you started a fire in the fireplace and you didn't open up the damper. Now you got smoke. Well, guess where your mitochondria is? All that thing that deals with the oxidative stress, right? And gives you that energy that you love. It's inside. Now you put that smoke all around that mitochondria. Now you feel really tired. Now you can't get yourself moving, right? So that tells me that there's cellular inflammation. So asking the question about energy, when are you most tired? Are you tired all day long? Do you feel like, right? Those are the questions that we need to know to kind of see, is there mitochondrial dysfunction? So all systems are connected. We kind of talked about the gut before, going back a little bit into your biology here. But I like this because it's talking to us about how the gut and the brain are connected, and how it even affects your hormones. And I'm going to go one more stage here forward. So when we have the blood being brought up to the brain, you have these microglia and these neuron cells, and these are brought up via the vagus nerve. And when we start to have toxins from the gut, they will make this kind of leakiness. So particles are showing themselves to the microglia that should not be. And at that point, we start to have brain fog. So maybe not remembering the words we want to say. We're trying to think of the word phone and we're like, this thing, right? Like that's brain fog. So that's kind of telling us if we start to have abdominal bloating, maybe we're starting to have constipation or diarrhea or reflux, some of those things, we probably have dysfunction within the gut. And if these bacteria are off, but guess what? These are where those amino acids are formed to talk to your ovaries. to tell them to give you the right amount of hormones. So it's really important that we're making sure that all systems are on board. Again, because if I give you hormones, you're not going to respond if I don't get all systems online. So environmental toxins, I do love that right now in the last year, I would say this has probably been a bit more in the limelight in the news and so forth, talking about plastics and phthalates and pesticides and so forth. These are big, big problems. And I'm gonna mention this. I actually made a post on social media. This was probably a year and a half ago. And they were saying, we want to raise healthcare for everyone that's obese. So over a certain BMI, we were going to raise their health coverage. And so I saw this, and I'm watching this ad, and I'm like, okay, well, maybe they probably use a little bit more healthcare dollars, and they're probably going to have more pre-existing conditions and so forth. But then I also thought about it. Okay, their crops have a lot of atrazine. And atrazine is on 90% of the crops, and it's actually in 90% of the water in Wisconsin. And atrazine is a known causer of diabetes, is a known causer in low testosterone and decreasing fertility rates, as well as cancer. So then I'm going, okay, so if the atrazine is in the water of 90%, how do these people even get away from there's diet and exercise, and you can choose. There are many things you can choose. But they also have a chemical disruptor that does not allow them to get better, right? So then how fair is that? So you kind of got both sides of the coin. And I think it kind of sheds light on that situation. And there's more of those pesticides, and as much as organic as we try to be, there's rainwater that comes off from other crops, and we get this from a lot of places. So I do think removal of source and trying to be the best we can be. But in that situation, I'm kind of going like, oh, I'm not sure they're really, like, I don't think there's a line you can really, as much as you'd love there to be, I don't know if there's a line, right? So this can really decrease risks of reproductive usage, but as much as we can do in not eating out of plastic containers, as long as we try to make sure that we're eating as organic as possible, we're trying to filter our water and do all these right things, we're going to limit the amount that's coming into us, and that's the best we can do in this crazy toxic world that we live in at this moment. And we can detox ourselves. And there's ways we do this. And I really love this hierarchy right here. So it's talking like you can't outsmart your body. So if we look at this kind of low base, we always want to fill our foundation. And this is looking at cortisol, insulin, oxytocin, and things like stress, trauma, sleep issues, blood sugar irregulation, sedentary lifestyles, dehydration, a lot of blue light exposure, and then high extending fasting. So this is our foundation. So if we have a lot of these coming in, we're not going to be able to get our hormones. So we got to start here at the bottom, and then move our way up. So pregnenolone and DHEA. So these are things like alcohol, excessive caffeine use, processed foods, long-term medications, chronic infections, and inflammations. And I see chronic infections in a lot of patients of mine, but that's kind of our second tier here. And then going up, hormones are at our highest tier here. So working from the bottom up is really how we're going to get the most optimized hormones. Ooh, love that question. Good. So chronic infection, and many people have chronic infections and they don't even know that they have them. And yeah, so one place that no one loves to talk about is the mouth. So your mouth, it's always traumatic, right? No one wants to go to the dentist. I don't ever want to go to the dentist. So if you've had a crown, root canal, implant, or wisdom teeth removed, you have a potential for what's called the cavitation. So a cavitation sits below, and it is almost it's a walled off infection, like it has a shell around it. But the problem is that your jawbone is very porous, and it has a connection to your systemic blood flow. You will be swallowing that bacteria. We do know that bacteria in your mouth, specific bacteria, will cause diabetes, and we find it in the gut. So it increases what's called glucose-producing bacteria. Every tooth has a dermatome in the mouth, so there's different organs that are affected by those infections. There's a study with 2,000 cadaver patients of women with breast cancer. 99%, this is irrefutable, 99% of them have a cavitation on the same side as the breast cancer. Every single one of my breast cancer patients will go for a 3D cone of their mouth. So most people, I've never had a patient with me that gets breast cancer in my care. They're usually breast cancer patients that come in to see me. I will make them get a 3D cone because they will not get breast cancer again if we can get removal of source. What caused the breast cancer to begin with? Breast cancer is not because of hormones. What happens is that you get some type of chemical, there's some type of infection that causes inflammation. When those cells are reproducing and they're getting like the DNA to come out, now it creates a cancer cell. Now, if you have family history, because there is genetic problem, right? That causes what's called 4-OH estrogen, which is a toxic type of estrogen. So say you have that increase of that. So now, when you have those cancer cells go out, now they go to the area that's already inflamed and has those toxic estrogens. Now you get a breast cancer. So if we have the communication between the two, which causes the inflammation, now you lead to the breast cancer. But if I can get someone to get the cavitation out of their mouth, I've never seen a reoccurrence of breast cancer, even with the use of hormones post. So yeah, absolutely. It's the same with prostate cancers as well. So we always want to make sure that, and prostate cancers mostly happen with the front teeth, usually urogenital or any type of ovarian, it happens to do with the front teeth. But yeah, always.
Did you say 3D cone?
Yeah, it's called a 3D cone. And actually what's really cool is most dentists have the capacity, because a lot of people do implants now and they're looking at the texture of the bone and how good it is to put the implant in. So you can get a 3D cone, and then I have a specific group of biological dentists that I use just because I have vetted their program, so I know kind of like what they do to get rid of it, and I know it's correct. But the pathology, it's very gross, but also cool at the same time. So if you're me, I think it's cool. If you're you, it's probably gross. But I've literally seen entamoebas, parasites, staph strets, campylomactors that come out of the pathology of what's in the mouth. The mouth is very dirty, it's gross, but that all gets walled and pocketed from what happens over time. And so yeah, the procedure is pretty quick, is pretty straightforward, and people do a really good job with it, but it's getting it done. But that's an easy one. And I will say things like 85% of people have had Epstein-Barr at one point, which is mono. So it's widely spread. So one thing I saw with COVID, so a lot of people with long haulers COVID, if you look and you actually check their Epstein-Barr levels, they will have been reactivated. So when the body's immune system has one other thing to fight, it's advantageous. It goes, we can party. So it leaves the spleen and it goes out and it causes a reinfection in the body. So we do see a lot of things, and it can be everything from EBV, CMV, HHV6, like there's multitude. And if we all did our viruses, we wonder if we were just licking handrails all the time and we're like, what are you doing? It's kind of crazy. But we do have Lyme disease in Arizona. It's carried in every blood-sucking insect, spiders, mosquitoes, everything. We were always led to believe it was from just ticks alone. It is not just ticks anymore, and I used to never test for Lyme. I had one patient I couldn't figure out. I did it. She had CDC criteria, Lyme disease, and she had never left the state of Arizona. That made me have a whole new belief in Lyme disease and being able to check for that. Mold. We have a ton of mold in Arizona. So these are all things that we see with chronic infections that most providers will not look for. So those are things I see a lot. Yeah, so really great question. Thank you. So I'm not going to belabor on this. I'm going to put this in the guide for you guys. So these are just the appropriate hormones that you should be testing. We should always be testing for your thyroid and your cortisol, how your brain is reacting to it, and how your adrenal glands are reacting, as well as looking at glucose. So how you have insulin, do you have insulin resistance? Do you have inflammatory markers? Is there a problem with your iron or your minerals? But these are things that we would be looking for on lab screening that would do with your hormones and hormone balancing. I love using what's called Dutch testing. Dutch testing is urine hormones. It's your metabolite, so how your body's metabolizing the hormones. And if you have a strong family history of breast cancer or uterine ovarian cancer, this is a way we can test for 4-OH cancer or 4-OH estrogens, which is toxic estrogen, just to see if you have a predisposition for that, because you can clear that out of the body. So there's different types of natural treatments. There's everything from things like black cohosh to dong quai to things like chaste berry to support both estrogen and progesterone, which we would utilize. I love using as much natural things as I can, but again, there are certain stages of lysis that we should be using bioidentical hormones for. We kind of talked about this just a tiny bit, but the Women's Health Initiative that was first originally put out was very misleading, and what was disseminated to everybody was incorrect. And what they were doing is they were actually testing with progestin, which is made from horse urine. So apparently horse urine is not good in the human body. I don't know, but it causes cancer. And the other thing is when we use oral estrogens, it does pass through the liver 100% of the time, which does increase 4-OH estrogen. So I never in my practice ever use oral estrogens ever. There's patches, topicals, pellets, there's all kinds of other modalities, troches, but I never use oral estrogens, and we never use progestin, which is what these studies were done. And then they told everyone that hormones are awful and you can't have them, and that's what they like to teach. And so that is starting to change. It is still currently in the medical community today, absolutely, but they literally have started to work to change this, but it is not completely changed yet, no. Literally medical schools are about 10 to 15 years behind. Yeah, what's actually going out in the wide. I know it's scary to think that, but it is very true. Yeah. So there's other ways in also eating and exercising for your hormones. I teach this a ton. I'm almost wrapping up here, but eating and exercises for your hormones, regardless if you're in perimenopause versus postmenopausal, we can work with the cycle. When you're no longer cycling, you do cycle with the moon cycle, which meaning when the full moon is out, you have the highest amount because the gravitational pull from the ocean, the waves are at its closest. And when you have the new moon, it's all the way out, you have the lowest. So we fast at the lowest, and when we have the full moon, we party and we feast, right? So we learn these kind of waves, and it's also the same for exercise. And I wish someone would have taught me this when I was 15. It matters when you exercise. You're more likely to get an injury the week before your cycle because progesterone helps laxicity of your joints. You're more likely to get an injury that week before. That is not a time that you should be racing your bike. But no one taught me that. So eating and exercising for your hormones can really capitalize on your hormone production and how your body works with it. I have an amazing CrossFit coach here in town. Her body completely changed when we worked with her hormone cycle, and she felt like she was cheating. I kid you, I could show you a picture of this woman. She was entirely ripped. She said, I'm not doing what I did before. I feel like this is cheating. This isn't fair. But it was because we were working with the hormones versus against them. And we want to always be working, because if we're working against them, guess what we're going to do? We're going to make extra cortisol. What's that going to do? Spill sugar, right? We don't want to do that. Right? We want to work with decreased inflammation. So I do teach a class on this, guys. And the cool thing is, this just like literally serendipitously, I'm going to be teaching a class on the 6th, which is pre-vival. It is free for 2 weeks. And what I'm going to do is in this pre-vival class, I get you prepared for what's called total body revival. And that just takes you through what would be looking at like a feast famine variation for your cycle and for your hormones and what that would look like. So I teach live. You guys can check us out, but it's a great class to learn about your hormones as well as environmental toxins and how to best eat for your cycle as well as for your body. So hormone imbalance can occur in both men and women at any age due to bodily system stressors. So asking the right questions. I want to give you that handout. I want you guys to be able to answer these questions for your providers and make sure they're asking them to you, as well as knowing what kinds of therapies you should be able to have, natural-based as well as any type of hormone-based therapies, and what types of labs you should be able to have. And we need to follow our hormone hierarchy. If we do not work from the base and work our ground up, we will not fix our hormones. Hormone balance is not a one-size-fits-all. you're going to take something different, and you're going to take something different, and no one is ever the same. There's no same protocol. And I want everyone in this room, I do not care if you hurt their feelings. Right. You need to advocate for yourself. Because guess what? I didn't advocate for myself enough. Guess what happened? Right? Like, that's not okay. And we all need to advocate for ourselves. I promise you, in my practice, if someone asks me for a test, I go, you know what, that could be a good idea. And I promise you, I will talk to any physician that they work with, because I do not get my feelings hurt. There's a place where I can learn something from somebody else, and there's a place that we can collaborate. Today, I literally figured out, with collaboration with another guy, figured out a woman that we have not figured out since 2021, and she hasn't been figured out in the last 25 years of her life. So if you have someone who is willing and does not get their feelings hurt, but you have to advocate for yourself first. Absolutely. So, absolutely. Thank you.